Jessie Hansen. I'll be presenting our social enterprise pitch for VaxTrac Benin. The problem that we deal with in Benin is that most clinics use paper-based record-keeping systems to track vaccines for children. It can be very inefficient. So what we realized was that this was leading to redundant cost and super inefficiencies associated with clinic administrative work and reporting. For example, health workers we found were spending 2 to 6 hours on average just to fill out these records instead of attending to patients, and the Ministry of Health was having to cough up the salary for this redundant work. So our solution was to provide developing countries with the technologies and the support they need to maximize the effectiveness of their vaccine programs. We have VaxTrac system is a vaccine management system comprised of 2 parts. First, a fingerprint scanner, which takes the fingerprints of both the mother and the child in order to create the individual file within the system. And then a mobile software platform, usually based on a netbook or a tablet, which allows all files from the clinic and from any clinic in our system to be accessible. This has allowed us, the innovation in this is to create the original vaccine system to go to a much more efficient system that looks like, this, Happy Health Worker. And this is the first time in Benin that a digital system has been used for information mapping. And we're hoping 100% of our clinics in our project will be using this effectively. In 2010 and 11, we applied for the Grand Challenge Exploration Grant with the Gates Foundation and were awarded it. And we first launched our system and pilot tested it in India and then in Benin. And this, of course, was our brainstorming stage. And later, in our early development stage, the Gates Foundation continued its generous funding and support, and we expanded into 2 health zones within Benin, and over the years have been developing the system. And now we're in our early implementation phase, where we, in 2015, will ramp up to 3 health zones within country identified by the Ministry of Health. And this is a 2-year grant. We partner with key health organizations, particularly the Ministry of Health, and we do ongoing monitoring in the clinics. We just pilot tested for the first time our baseline approach and our formal evaluation tools. And we developed an evaluation which tracks indicators related to the results framework we've developed. This is the results framework. The first result is to improve engagement of families in vaccine services. The second is to improve performance and efficiency within the clinics. The third is to improve performance and inefficiency at management levels at administration. And then fourth is actually the system itself, for it to be sustainably integrated into a standard workflow. So what's the expected impact? We hope that in each health zone, 100% of our clinics have trained staff utilizing the tool, and that the administrative burden on the health workers and the real costs related to vaccination record keeping will decrease by X% at local level. What we hope is also to conduct a 2-year RCT evaluation, which will actually include in about the spring our first cost efficiency analysis. Is our program effective and costly? We want to examine the impact on administrative work and reporting efficiencies, and then we want the reduction of real costs associated with child vaccination record keeping. So we're seeking guidance from you on how best to conduct a quality, cost-effective analysis for this mHealth project. We haven't found much literature on it. Are you a consultant with experience or expertise and you want to help us? Please give us advice. And 2, do you know any best practices or lessons learned that we should use? And do you maybe want to potentially partner with us on our very exciting project in Benin? Thank you so much. Hope to see you at the pitch.